Artificial disc replacement is a metal and plastic implant that is used to replace the disc or the shock absorber that you normally have between the two bones or vertebral bodies in the spine. Artificial disc replacement is very similar to a knee or hip replacement, which acts to keep the normal motion of the hip or knee joints by gliding plastic and metal implants, replacing your normal mat. So why do we even have artificial disc replacement? Spinal fusion is something we've been doing for 40 or 50 years, and it works really well in the cervical spine especially. And one would say, why even try something new? Well, the issue with spinal fusion is that the surgery normally goes well, but what happens over time is the disc above and below that start to wear down. And we feel this is because the stiffness of that disc causes the disc above and below to move more than they should, and thus degenerating those discs. And the biggest issue is that patients end up having to come back for another surgery because those discs wear down. So the concept is, if we keep the normal motion at the original disc where you had surgery, the disc above and below will have less stress and hopefully not degenerate. And the good news is the literature is really starting to show that there's a great improvement in keeping that normal motion. I've moved my practice to one that focuses on trying to use artificial disc replacement before using more invasive treatments like spinal fusion. There's several reasons I do this, and the data has really supported it. One of the early ones is the quicker recovery. With the spinal fusion, you have to keep your neck still while you're recovering to allow the bone to fuse together. But with artificial disc replacement, we actually try to move as soon as possible to regain your normal motion. That allows you to get back to your more active lifestyle in a much quicker fashion. The other thing is, by keeping that normal motion, it puts less stress on the disc above and below that, and this allows for less revision surgery. So 3 major reasons that I really favor artificial disc replacement are quicker recovery, more normal motion, and less chance of revision surgery. The question is, what do the studies show as far as artificial disc replacement? So there's been a lot of studies comparing fusion and artificial disc replacement, because that's the big question we want to answer. And one of the really strong studies was on the Mobi-C implant. At 5 years out, there was some good results. So overall success is something that's defined by the FDA, or the government regulation group that tells us, or that evaluates these implants. So overall success requires a 50% improvement in function. It requires no secondary surgery, so no repeat surgery at that level of surgery, and no major complications. So these are 3 criteria to realize overall success with the FDA. And these are hard to hit, but what they've shown with the Mobi-C implant is that 5 years out, there's a 64% overall success rate with the artificial disc replacement. This is compared to only a 34% overall success rate with the fusion. So nearly twice as successful at 5 years out. And that's a really important reason to do artificial disc replacement when properly indicated. Well, the indications for artificial disc replacement are essentially the same as spinal fusion or ACDF. So if your doctor says you're a candidate for ACDF, you most likely are a candidate for artificial disc replacement. There are some limitations to that. One is if you have instability of the spine. In other words, when you bend back and forth, does the spine move more than it should? If that's the case, you cannot have an artificial disc replacement. If most of your pain is coming from facet joints, or the joints in the back of the spine, artificial disc replacement won't help that. If it's more than 2-level surgery, artificial disc replacement is not an option. Most things that indicate for a fusion are the same as for artificial disc replacement. So that is neck pain, arm weakness, arm numbness, coordination problems, balance issues. Any of these that are related to a herniated disc or spinal stenosis putting pressure on the spinal cord of the nerves are indications for this procedure.